All right, here we go for another round. This one today is focusing on just two wisdom teeth. This young man in his late teens, early 20s, has a fully erupted wisdom tooth on the top, number 1, and then number 32 has a bit of horizontal impaction. You can see the gingiva over the top here is covering over completely. The problem that this caused is some pain in the area, some swelling, and when we check it with perio probing, we get pus that comes out along the side there. So bacteria have gotten their way down underneath and are causing some problems underneath the gingiva. So this one needs to be removed. We elected to remove this one as well because it was malposed, non-functioning. So some things to think about when removing these two teeth. Obviously, we want profound anesthesia, all the goodies there, but we want to also consider where our landmarks are that we want to be careful of. Here's a big one, the IA nerve that sits right across there. We can see where that root sits right next to that IA. As long as we're not penetrating down to that area, pushing that root into it, and the root comes out this way, we should not have any residual numbness problems. Obviously, anything can happen with anesthetic and allergic reactions and things like that, but very unlikely. So we got the IA nerve there. The prospect of removing the tooth, we're going to make a sulcular incision across the tooth here, straight back, and then I like to do more of kind of a 90-degree as it comes off the side. There's no reason to come back straight or back this way. That just makes the flap wider, and we want to get access down to this bone here. So if I do a 90-degree turn here, that flap then comes better, and we get more access lower on the tooth, which is where we want access to it, and you'll be able to see that in the video. So we'll section the tooth straight through. Once we've got access to it, we'll trough and then section straight through. This guy, hopefully the top one comes out nice and easy. If it doesn't, we can section that. The lower one, same thing. Hopefully it comes out nice and easy. If it doesn't, I would section it again, with the lower part of the tooth being smaller than the upper part here, so that it actually comes out. A common error is we cut it straight down like this, and the lower portion ends up being wider than the upper portion, and you create a locked in area, and then you have to section it again. So make sure when you section, make sure the lower section is going to be smaller than the upper so that it can actually come out. And then you would gently take out that root portion. Then this upper tooth, we're going to do him last, the easiest one last. It'll be rotating out and to the side this way. Pulling it straight down is not helpful. Sliding it back. If you push too hard, though, we can lose this maxillary tuberosity. So just be as careful as you can with that. When we place the blade of the 77R or Ironman, the blade will be kind of set like this, and we're going to be rotating with the top section, or the more coronal section is going to be rotating this way, and then we're going to lever it so that it slides out. You'll be seeing it upside down because it'll be point of view. So let's jump into the video now, and we are going to play it at 2x just so we're not sitting here forever. Okay, so you can see so I do the sulcular incision all the way around to about halfway or so, then I'm coming straight, or I'm coming, kind of obliquely a little more to the side, and then about 90 degrees out. So the further you get on this side, the more risk we are of getting the lingual nerve involved. So really just across the top, at least uncovering the half of the tooth should give you plenty to work with. Go to the periosteal elevator number 9, also called the Wonder Woman. You can see where I have it the curvature against the tooth in the initial, and then I rotate it around to get a little bit more leverage. You don't have to release it.
Appreciate it. Is it right over there?
And it's a full thickness flap. Okay, so here's the crust of bone right here. Here's the tooth. That's the crown of the tooth. There's the midline of the tooth about right there.
Last exposure.
Okay, so I'm going to be taking the handpiece. I'm going to be troughing around the side to create some space so we can get some movement and actually get access lower to the tooth, and then we'll be sectioning. Sorry you can't see it quite as well. The camera actually sits a little bit higher on the head, so I need to work on making sure that when I'm filming it, I film a little bit lower than expected, but you'll get the general idea here. So you can see I've already troughed down alongside the bone as well. Okay, you can see we're sectioning into the tooth here. I like to section about 75 to 80 to 90% through the tooth, both vertically and down through the furcation if I can get to it, and then through the tooth from facial to lingual about 90% or so. Okay, so I've sectioned now through the tooth. I'm going to put the 77R, the Captain America, or the Iron Man in there. Set him in sideways and just a little crunch. And she wants to. I want to make sure the assistant has good chin support because I'm going to be pushing down pretty firmly. Notice also the Minnesota is sitting right on the bone. We don't sit on soft tissue or press on soft tissue. We want to set it right on the bone. A little bit of soft tissue right there, kind of impinging it as I was noticing it flexing out. So I press that back just a little bit because we want this to slide up and out. Okay, so I'm rotating the top side of that blade against the tooth, and then I'm anchoring or levering it to slide that section up. And that's going right into the pulp chamber there. So that back side is completely out. Nice and clear.
I was getting a testimony of the Iron Man. Look at that testimony. Look at that.
Okay, I'll slow that down to regular speed. Okay.
Just getting a testimony of.
So this lower section, same thing. Nice and gentle pressure, rotating it with the coronal portion is going to be we're moving to the distal. Gentle pressure, and if it comes out easy, great. If not, we want to section a little bit more.
Look at that testifying. Look at that. Testify, Iron Man. Testify. Molt. That's how Iron Man does it.
So we want to clean inside just a little bit. We don't need to go down deep, and then we want to clean the ridge of bone right there that gets a little bit beat up. There's not much else super exciting to see here. Clean along the side of that really well. We irrigate underneath this flap the most. That's where we need to keep clean. Inside the socket is not as helpful, but we need to go across the side here. Underneath the flap, that's the most likely area that we'll get some fuzz that will want to percolate and cause problems later. Plenty of sterile saline, 0.9%.
All right, tooth is out. We're just putting some stitches in right now. Living it up, baby. That perceptual ability part of the dad is for. Look at a suture needle and say, which direction is going to be feed?
So you can see where the flap is here. I like to place one tacking stitch across here, and then I like to do another one across here. 3-0 chromic.
Going to be personally.
Sometimes the tongue be a little bit here. Poke the tongue just a little bit. Make the tongue not fully asleep on that side.
Like I passed. Don't judge me.
Don't remind me. Don't judge me.
Hold that.
No, let's go. You can judge me.
Okay, then we'll do a double throw. Grab that, tighten it down. We'll do a reverse single throw, and then a final single throw or double throw, either or. And then trim it, 4 or 5 millimeters long. And then put that second tacking suture in. Now we're going to the upper tooth, periostal elevation.
Sport right here. Sharp. Is that feeling sharp at all?
Okay, Okay, same thing. We're going to be rotating the coronal portion out and back, and then leveraging. This side goes down, that side gets leveraged up. It's not going to take very long.
Just a little rotation here.
And it's medium pressure. If you think of 10 out of 10 being as much pressure as you could rotate on that, you'll be doing about 5 or 6. You don't want to go beyond 7 or 8, or that's when stuff starts to crack and break.
Rotation Soros. Rotating.
And it's normal. It starts out kind of tight, doesn't seem to want to move. That's okay. Just get it in there, lean into it, hold, lean into it, hold, lean into it, and hold. Just give it time.
Pressure and rotate, pressure and rotate. Persistent pressure. Oh, pressure. You're doing great.
So I've rotated, and now I'm leveraging this side down, and that front tip is going to be popping up there, pushing it out.
There.
I need to work out my arms really bad.
That's true. Weak sauce forearms. You got like 2.5 arms. So weak.
There it goes. Tooth is out. So hopefully there's some good little tips and tricks that you learned in there. Same protocol as the other. I give the patient a 60-second rinse with chlorhexidine before the procedure starts. Also 600 milligrams of ibuprofen, 600 milligrams ibuprofen, 1,000 milligrams of Tylenol, and 8 milligrams of dexamethasone, either injectable or in tablet format. So best wishes and happy teeth removal.